helping make your life easier. Moms Every Day.
Welcome to momseveryday.com. I'm your host, Jen Lennon. Today I'm joined by Prashant Krishnan and as well as Scott Louie. They are both physicians with Peak Gastroenterology. So welcome, guys.
Thank you, Jen.
Thank you, Jen.
Now, Prashant, first of all, gastroenterology, kind of a big word to say anyway, but what is it that you guys cover in your practice?
Well, Peak Gastroenterology has 7 physicians and one nurse practitioner.
Okay.
And what we do is, as gastroenterologists, we take care of the entire digestive tract, down from the esophagus, stomach, small intestines, colon, pancreas, bile duct, and gallbladder and liver. So those are all the areas that we cover.
That is a lot to cover. Okay, I can see why there's 7 people. So in covering all of that, obviously there's a lot of different topics that you would hit. So Scott, I know one of the topics, I suppose that a lot of people maybe might be embarrassed to talk to their doctor about, but gas and bloating. It happens to all of us, right? So what are some of the causes of gas and bloating?
Yes, gas is a very common complaint, and bloating in particular, especially for women. Common causes are basically swallowing or consuming something that has gas or air in it.
Okay.
So if you're chewing gum or
drinking
through a straw or drinking soda pop that's carbonated, or produced by the digestive tract during digestion of or breakdown of food products.
Well, yeah, I mean, I'm sure your grandma always said, oh, well, it's just the food, it makes
Right.
you gassy, but there really are foods that
There
can
are
make you gassy,
gas-producing
right?
foods, yes. Beans do produce gas. As humans, we don't have the digestive enzyme that breaks down one of the sugars that's in beans. The cruciferous vegetables, broccoli, cauliflower, etc., those also are difficult for us to digest. So they're gas-producing foods that can give us more gas.
So that is real. So if you're experiencing gas, one of the first things to do, I would suppose, would be let up on the chewing gum or the soda, or
Correct.
lighten up on some of those foods and see what happens,
Don't
right?
drink through a straw. Cooked some of those cruciferous vegetables to help break them down more.
Okay.
Take a digestive enzyme like Beano that has a mold-produced digestive enzyme that helps us break down the sugar that's in beans.
But then, doctor, if we try some of those things, how do we know that it's beyond normal then? And what do we look for?
Right, well, everyone produces gas. That is normal. The question is it uncomfortable? Is it embarrassing? And what you're really looking for are alarm symptoms. If you're
Okay.
having abdominal pain that wakes you up at night, new onset of diarrhea, weight loss, blood in your stool, anemia, fever, vomiting, when you develop those types of alarm symptoms, that's when you need to contact a healthcare professional. And
Okay.
if you contact someone at Peak Gastroenterology Associates, our staff will make sure that we do what's appropriate to make sure there's nothing serious behind those symptoms.
So, Dr. Louie, what might be causing some of those symptoms then?
So common causes, as we mentioned, besides the behavioral things or digestive things, would be conditions like celiac sprue or gluten sensitivity,
Okay.
lactose intolerance, irritable bowel, inflammatory bowel diseases like ulcerative colitis or Crohn's disease,
Okay.
small bowel bacterial overgrowth, where you have an excess overgrowth of bad bacteria in your digestive tract, which
All
is
right.
getting more attention with regard to digestive diseases, including potentially a link to obesity. So
Okay.
looking for those conditions through endoscopic procedures, blood tests, simple stool examinations, and also just getting a complete history from the
Yeah,
patient.
talking and figuring out what might be behind it all.
Right.
Well, I know it can be embarrassing, but it really is important that people get in touch with doctors and figure out what might be causing it. Thank you for sharing the information today. We appreciate it.
Thanks for having us.
Thank you.
And for more information about Peak Gastroenterology, you can go to our website, momseveryday.com. Thank you for joining me today and every day. I'm your host, Jen Lennon, for momseveryday.com.
Visit Moms Every Day online or on the go through our Moms Every Day app. Download it today to find local solutions for you and your family.